Good evening, ladies. Good afternoon. Hello. Knock, knock. Knock, knock. Hello. Hi, ladies. How was your Wednesday so far? Good? Yeah? Or no? Yay, I can see 3 people. Hi. Thank you, ladies. Thank you, Arshi, for joining in. Thank you, Shubha, for joining in. Yeah, it's Wednesday. How was your hump day? Good, better, worse, worst, or best? Mine is always worst, but still I'm smiling. No, not always, but majority of the Wednesdays. It's a very, very busy Wednesday for me, all Wednesdays. Kind of like sometimes think, oh, why did I start Wholesome Wednesday? Probably I should have picked up another day, but no. It's got its name now. It's the 75th session. Thank you, Lata, for joining in. Thank you, Varsha. Thank you, ladies, for joining in. Hi, Varsha. Noor, if you're watching, I have already tagged you. See whether you can come on the frame. I'm kind of like hinting you well in advance. Hopefully this should work. Hi, ladies. Welcome, welcome. We are just chatting away. So did you all have a great Wednesday? The weeks come and go, and we are almost finishing off 2021, isn't it? How strange. Hi, Rekha. Thank you for joining in. Hi, Simita. Thank you for joining in. Such a great support from the family. I'm so pleased to see that. Thank you, ladies. Look, I've got quite a few now. Let me start. Welcome to Wholesome Wednesday session number 75, the 75th week. Today it's all about sarees, of course, as well as we are putting a tick mark or a checklist to keep our mental health and well-being. Rather than mental health, I would say well-being. And Dr. Noor Makhija would be presenting the session tonight. I'm very delighted to present her. I'll be bringing her on the frame very shortly. I've already hinted her to accept my request, which probably she would have done. But in the interim, let me just carry on with my usual kind of like, activities or whatever I do for my Wholesome Wednesday session. Of course, birthdays. Today I've got 2 gorgeous ladies celebrating their birthday. One is Rekha Rao and the other one is Renushri. And I see a lot of traffic wishing the ladies a very happy birthday. I'm so excited. Everyone is very happy, isn't it? If someone wishes you on your birthday, it's so special. So I'm really pleased to see the traffic and keep the traffic moving, all right? Don't stop. I need constant traffic to flow through, wishing the members a very happy birthday. There should be plenty others, but this is what my system picked up. So I'm just wishing. And for all those who celebrated their birthday from last week up until yesterday, wishing you all a very happy birthday again. Now, coming to my sari, I'll do a spiel of my sari before I do the national days. This sari is basically a gifted sari from one of my mom's friends. If you're watching, you know who you are. Thank you very much for the gorgeous sari. I'll be posting it tonight. It is a Georgette sari. It has got pinnate motifs, as you all can see, and a beautiful border, and it has got a purple selvage to this one, and I've just paired with metal bangles and blue crystal jewelry, and of course blue sandals, and of course my beautiful clutches, right? So that's my styling for today. But This is the third time I've draped this sari. There's a little spiel to this one. Okay, the very first time when I wore it for a 60th birthday of a dear friend of mine. And there comes 4 other gorgeous ladies in a similar sari, and all of them are from Karnataka. But surprisingly, all of them brought their sari in different places, but from Karnataka. One was from Hubballi, I think, or maybe Ballari. The other 2 ladies were from Bangalore, and that too totally different places. And mine, of course, was from Mysore, I think. So all the 4 saris were brought in different destinations in Karnataka, and we were so surprised to see all the 4 of us drape the sari. So I'll be posting that picture tonight when I do the post. And that was such a special thing, like, out of nowhere, all the 4 ladies, almost similar saris, and I was kind of like, surprised. Normally, it's very common with your, ordinary saris, like obviously like your Georgette ones and everything. It's very common, but especially with the hand-woven saris, it's not always the case. But it kind of like reminds me going back to my childhood days where I studied. I studied in Avila Convent, and there are lots of ladies from Avila who are in the group. They would kind of like relate to 2 gorgeous teachers who used to wear exactly similar saris, be it Kanjivaram, be it cotton, but most of the time they used to wear Kanjivarams and Gadwals, and now I'm kind of like recollecting, what saris they used to drape. It was exactly similar saris, and they used to go to the weavers and get that woven in those days. This was in 1975 to 1980s, and it kind of like dates back to those. And it's such a good memory, like, you can get the saris woven in similar colors and similar styles through a weaver. So there you go. But these ones, obviously you do get it, but it's kind of like, it was surprising to see all the 4 ladies drape that. And the second time I draped this sari was for Dr. Noor Makhija's Sangeet. So I thought, okay, I was just kind of like thinking which sari to wear, and then I thought, okay, I will pick this one. Out of nowhere, like, it's just suddenly kind of like, lingered in my mind. Yes, I did drape this for Noor's Sangeet. So Noor, if you're watching, I don't know whether you would recollect seeing me in this sari. Obviously not, because you were busy with your Sangeet activities, right? So yeah, that's the spiel about this sari. So there you go. Every sari has a story. It's not a story, but I thought I will just share it. So now, coming to the national days, I'll be very quick. And this is a sweet treat. Today is National Baklava Day. Just enjoy a baklava. My extended family has just arrived from Townsville, and they all have gone out to a Middle Eastern restaurant. I'm sure they would be enjoying a baklava tonight. Probably they might get something packed for me. There you go. National Hiking Day. It's again connected to our mental health and well-being. It's good to hike, which is very relaxing, and it just rejuvenates your mind. So make sure, ladies, you just stroll around, or obviously Sydney siders can't do the hike in the night, but yay, there is a hiking group which does hiking in the nights. So perhaps maybe you can explore, but it's too late. But maybe during the week or during the month you can explore. There is a hiking group which does night tracks and night hikers, they are called. So perhaps you can explore that. The next one is the National Testosterone Awareness Day. So just as we talk about women's health, men's health also come into picture today. It is to celebrate the hormone, and which creates the awareness about its importance. I won't talk much, but yeah, that is what the testosterone is. And the next one is the National Unfriend Day. Who would ever think of unfriending someone? But yay, social media does this. So if you haven't interacted, or if someone has interacted with you for quite some time and who is through an acquaintance, perhaps this is the time you can revisit and unfriend them. So there you go. I never heard of this National Unfriend Day, which is interesting, right? The next one is the National Educational Support Professionals Day, which is to honor the education support professionals who work on a daily basis in public schools and it could be in the community who help the students inside and outside the classroom. The next one is perhaps you all can relate to, which is National Homemade Bread Day. I'm not sure how many of you all would bake a bread at home, but if you haven't, there are so many easy websites which take you through even without an oven. So you can bake your bread even on the pan. So perhaps maybe you can explore that if you just want to kind of like support the National Bread Day. The next one is the World Prematurity Day, which is basically to kind of like support and be compassionate with families who have the anxiety of premature birth. By observing the World Prematurity Day. It often happens. Perhaps maybe we can check with Noor when she joins in. There is something here from Noor. Just a second. I am online. We'll wait for you. Await your request to join the frame. I think I should be able to get you, Noor. No, can you, in the interim, Noor, can you check whether there is something in your notification folder which is waiting for you to accept so that I can bring you onto the frame? Yeah, try and do that, right? All right, continuing with my National Day. It's also Geographic Information Systems Day, which is called the GIS. So whoever is a national geographer, interested in technology, and just go for it. Just enjoy your GIS day. The next one is another one which I can kind of like relate to. It is it's the Guinness World Records Day. This is a book which contains records set from all over the world, and I can very much relate to this because it just happened by chance, and it was on the 6th of April 2015. Shri Ganapati Sachidananda Swamiji had visited Sydney, and there was a musical therapy / healing meditation session which was called Australia Nadasagara. And I was part of it and did not realize, I think it was a packed audience of about 3,000 or maybe 4,000 members. Yes, Noor, I'll bring you onto the frame. Yay, thank you. It'll be good. So Noor is joining in. So it was a packed audience, and I never knew that Ganapati Sachidananda Swamiji was doing a healing therapy meditation session. So out of nowhere, we were asked to stand, and the Guinness Book of World Record guy kind of like, comes on stage as well after the session finishes. So we were part of this meditation session led by Shri Ganapati Sachidananda Swamiji. And it was a record break because at any given point of time, there were so many people in the musical healing therapy session. And we were kind of like, notified that we were, entered into the Guinness Book of World Records entry. So that was kind of like, I thought I would share that because today is Guinness World Records Day. So yeah, it was really interesting. So Noor, it did say it was adding. Can you try again, Noor? I did approve your request. It said it's adding and disappeared. It will add in a minute. It's still flashing. It's still flashing. All right. So while Noor is getting added, I'll just wait so that I can introduce Noor while she's on the frame. It says it's connecting Noor. So hopefully you should have. Yeah, you're already connected, Noor. I can't see you though. Okay, while you wait to do that, I'll just say hello to a few of you ladies. Varsha, I think you said relaxing because I was asking you a question. How was your Wednesday? Thank you very much. It's good to see that you had a relaxing Wednesday. Radhika, hi Emma, looking lovely. Thanks, Radhika. Thank you so much for joining in. And Radhika is wishing Rekha a very happy birthday. Thanks, Sadhana, for watching. Thank you, Lata Auntie, for joining in. Thanks, Pavana. Lata says, hello, Hemaji, how are you? Good, Auntie. You need not call me Hemaji. Thank you, thank you. Divya, sorry. Noor, can you try again, Noor? It says it's adding and it says it's connected. Yay!
Hello.
That's my gorgeous Noor. Look at you.
Hi
Oh,
everyone.
I'm kind of like forcing. Can you just lower your phone or your iPad a little bit so that your head is not chopped off?
There we are.
A little bit.
Yes.
Better? Otherwise, when I kind of like, do the
I didn't get that. Could you try again?
Your top gets chopped off. Yeah,
Okay.
that's perfect.
No problem. Sorry about the technical.
I'm getting all the younger ones to drape saris.
Yes, I'm quite proud. It's the first time I've not relied on my mum or mum-in-law or aunt. So thanks for the inspiration.
Thank you, Noor. Just 1 second. I'll just say hello to these ladies. There were 2 more left. Sangeeta, thank you for joining in. And the next one is Divya saying hello, ma'am. Hi, Divya. Thank you, ladies, for joining in. So Noor has joined. Let me introduce Noor, and then we will just attack her with questions. Right. Okay, I'll formally do your intro, Noor. So welcome again, ladies, for the Wholesome Wednesday, session number 75. And today it's all about saris, and Noor is also draped a sari. And today it's all about women's health check. So she's Dr. Noor Makhija, who will be shedding light on health pertaining to perinatal health, because she's expecting, right? She's going to let us know about that. She's due next month. And the cervical screening, breast screening, colon cancer screening, general health checks, talk about blood pressure, diabetes, skin cancer, cardiology, immunization, and most importantly, the COVID vaccination. How can I forget COVID vaccination? So these are the ones which are meant to keep us healthy, right? So ladies, the body of ours and yours is so priceless. So to take care of it, someone has rightly said that health is not valued until sickness comes. So make sure that health is wealth and take care of your health, right? So Noor, Dr. Noor Makhija is a general practitioner. We call general practitioners as GPs. She's from Sydney, and she's a young practicing GP from Sydney, in particular Hornsby area. She's been working in general practice for the last 5 years and is very passionate in advocating women's health, mental health, and general preventative health care. She hopes to gain some insight into the importance of women in prioritizing themselves and their health. She's currently expecting her first child, as I mentioned, so she will also be taking the opportunity in discussing some points about perinatal health. So young moms to be, or whoever is wanting to become a mom, so please note all these discussion points which might be helpful for you all later. In her spare time, she enjoys socializing. Who doesn't like socializing? Traveling. Yes, that's been stalled since 2020. Probably it would resume for Noor next year when the bub age.
Hopefully.
No, you can do the local traveling, right? So you can do the local traveling. And she's also into creative arts, and which I didn't know, in particular, watercolor painting. I didn't know, Noor, of that you can paint. Wow. But she's a beginner in the sari world, which she did express, saying that she did not seek anyone's help to drape her today's sari. That's wonderful, Noor. I'm very, very much impressed. And she likes silk or chiffon or delicate embroidery saris. Anyway, so if you have any questions for us ladies, please keep them ready, or we will just kind of like, discuss something in general so that there is take-home messages for each and every one of you. So Noor, tell me a bit about yourself. I know I have told about you, perhaps maybe from your end, it makes a lot of difference.
Sure, thank you, Auntie. It's good to be here. Hi, everyone. I think we probably have some guests from around Australia, maybe India as well today.
Yes, so I've got a whole heap.
Yeah, lovely. Well, as Hemanti rightly introduced, I'm a GP. I've been practicing for the past 5 years or so, and currently working in the Hornsby area in Sydney. So women's health is definitely one of my biggest passions in general practice, along with mental health and things. So hopefully I can shed some light today into why women's health is so important. And I think as all of us are quite aware about, the level of responsibility we have as women, and we have quite busy lives, whether it's looking after the family, looking after the house, and the list goes on, work life and balancing
but we
that
tend to ignore, Noor. We kind of like brush it off, saying, oh, that's secondary, family comes first, and we just shrug our shoulders and say, oh no, that's okay, we can carry on. But that shouldn't be the case, right?
Exactly. So that's exactly what we tend to do. We prioritize everyone else, isn't it? So but I think what I'm trying to instill in all of us today is also that we do need to prioritize our own health. If we have our full health with us, we can also look after our families and everyone else optimally. So I think that's also important. And I'm learning that, as you said, expecting my first child, I need to also realize to prioritize my health so I can also look after the baby. So
that's right. That's right. So just to share some tips, like, what you have to do. Let us start off from the perinatal health, considering that, you are going through and you can very well relate to it. So what exactly is needed, like, to keep oneself kind of like, focused and fit, especially at that time of your period, like, where you're going through a lot of imbalances, everything, like, it could be family, it could be in your body, it could be, mentally, it could be physically, anything.
Yeah, that's right. There's so I think in the perinatal health time, so I'll start even before, trying to conceive or having conceived. It's very important to actually optimize your health at that point. I always advise my patients, if you are even thinking in the next year to start a family, it's a good idea to make an appointment with your GP as a first line.
No, I'm very new to this, because coming from a 30-year-old background wherein we did not have anything about, going to a GP for consulting about this, I have no
Yeah.
idea how it has progressed so well. I
Yeah,
think,
yeah.
there are so many people in this saree gallery, as well as because I'll be uploading that onto Instagram and YouTube. I'm not sure whoever sees it. Probably it
Yeah.
will be a learning curve for them so that they are mentally prepared, that they can go to a GP and discuss. Is that correct?
That's right. So, you know, going to the GP would be the first line. So, so we can optimize your, your nutrients, like your iron levels, making sure that you are taking prenatal vitamins. These are very important, ideally at least even a month before trying to
Before?
conceive. So, yeah.
Never
So
knew
a lot
anything.
more
Like,
knowledge
it
is
was
there
only
now.
when,
That's
when we
right.
got the results saying, positive or negative, we used to run to a doctor. It was
Yeah.
probably at that time, we didn't even know the difference between an obstetrician and a gynecologist, because in India, they are all combined, like, it's obs and gynae, that's what they
Right.
call. So we kind of like ONG, no, ONG is your obs and gynae there. So we just used
Yes.
to run to them, not differentiating who is who. And then we used to
Right.
say, our results is positive, what are we doing?
Yeah, I
Probably
know
that
that.
may still be the case until and unless, you kind of like into it and educated, and you kind of like, Google around to see what's required
Yeah.
and everything. Yeah, interesting.
That's right. I mean, in India, that we you don't have as much of the general practice culture. So, of
Yeah,
course, O&G, obs and an obstetrician
fine.
would be the first point of call.
Correct.
But here, it's in Australia. I think we have quite a teamwork approach with this. So, I think, yeah. So one is, of course, trying to get your nutrients in check before you fall pregnant, ideally. And the other thing is as well making sure that we optimize all your immunizations that are recommended prior to falling pregnant, such as rubella and things. So yeah, so I think that's an important thing. And of course, when you fall pregnant, maybe you haven't had the consultation before. That's fine. Again, making that first appointment with the GP, and we can advise you if it's new for you. A lot of things are involved: getting blood tests, scans, and organizing
Everything.
things with
Yeah.
obstetricians. So I think it's also very important. Why I do suggest seeing the GP, during or before, is to optimize your mental health as well. I think that's
Yeah.
something which is very important, and we don't realize the how common it is actually
Yeah.
for depression, anxiety during or after postnatally as well.
Yeah.
So this is a good contact to have from an early stage, non-judgmental kind of person, external, who you can just talk to and just be vulnerable with if you need to.
Right, right. See, there's a lot of things which I was not aware of, like, taking back 30 years ago to now, how
Yeah.
medical field has improved. And it's a good take-home message, like, for whoever listening there, whoever wants to become a mom, I think a take-home message here. And especially if you're in Australia, very good to know. And even if you're in India, I think it would probably be the same. But again, consulting the doctor would be ideal, right?
Yes, that's right.
Yes. Yeah. Perfect. Perfect. And what else is required? Like, I know you kind of like mentioned about screening or
Yeah.
optimizing menstrual cycle. Like, what does that mean? Optimizing menstrual cycle, like, before falling pregnant, is it?
Yeah, so I guess so that we can make sure you've got as regular cycle as possible
Cycle.
before falling
Mhm.
pregnant, as well as if there's any sort of issues with your periods, painful periods, and there's
Yeah.
multiple conditions that we might need to look into, just to maybe diagnose if they haven't been diagnosed, so that we can give you the best care. And if there's any obstacles in falling pregnant, you know, we would need to look into if it's to do with your cycle or anything else. Yeah.
Okay. So what's the test required? Is it just the normal blood test, or is there any other specific test to be done?
So if there is any question about the menstrual cycle being a bit irregular or, you know, abnormal, we might want to do some hormone blood tests. We might need to look for conditions such as polycystic ovary syndrome, which is a very common condition that can affect the menstrual cycle. Or we may also need to do a pelvic ultrasound, for example. So yeah, there's a few different tests that might need to be looked into.
So those tests are pretty common in India as well, right? Because
That's
my
right,
wider
yeah.
from India, so that's available in India as well.
Yes, yes,
yeah,
that's right.
Okay, good. What else do I have to ask you? So what about food safety during the pregnancy?
Yeah, so that's another topic that we will approach during your initial consults if you fall pregnant. Now, I guess there's a whole magnitude of things, and when I talk to my mum-in-law, they'll all say, "Oh, we didn't know about any of this when we were pregnant, and we ate everything." Yeah. So maybe we have too much knowledge now. Some people might argue, but there are a lot of things which we, do advise. Obviously, quite obvious things like alcohol, smoking, those things. But of course, then there's some foods such as soft cheeses or salamis, like raw seafood.
Because the processed meat kind of.
Processed meat. So all of these main risk is a risk for a bacteria called listeria. So you might have heard of that one. Yeah. So that's why these foods are avoided. Certain foods are avoided. So yes, and I'd like the Food Safety Food Authority website from the Australian government. That's a really good summary. So I mean, that's something that people might check out.
Kind of like recommended, but they do say like a wine, not a day, maybe a week. It's okay to drink a glass of wine. Is that still okay? Because I've got
in
so
pregnancy
many wine.
or in pregnancy, you mean?
Yeah.
Oh, look, see, the issue is that there is actually no safe amount of wine that I guess there's a lot of ethical reasons to do studies about, say, alcohol and the amount. So I'd say probably the safest things to is avoid. I have found that quite tricky in my pregnancy, but you can always smell the alcohol and get a little bit of a craving, which is satisfied that way.
Right. Good tip there, just to smell.
Yeah.
Yeah. What about immunization? So, like, is there anything that the moms to be, or the moms who are on their way, during 9 months would be like, would that be important? Like, what kind of immunization are you kind of like, is important?
Right. So particularly rubella is a very important one. When you actually fall pregnant, or ideally before, that's why we'd like to see you before we check if you're immune to certain things. So rubella is one of them. There's an issue with development of baby hearing issues if you get rubella in pregnancy. So that's why like to have that done before, ideally. It can't be given during pregnancy because it's a live vaccination. So if you aren't immune to it and you find out you're pregnant, we give it to you straight after delivering, so that through breast milk the baby can get some antibodies. Otherwise, during pregnancy, the flu vaccination is something we recommend because, again, your immunity can pass on to the baby. Whooping cough, that's a very important one as well. So and now that since we're kind of in this pandemic world, I will also mention the COVID vaccination. So there was a lot of question whether it's safe during pregnancy or in breastfeeding mums. So really, there's been a wide range of studies now that have proven safety in pregnancy, and it's actually very important, particularly that pregnant women get vaccinated for this, because COVID, if you develop the COVID disease during pregnancy, there can be much worse outcomes for the mum, higher ICU admissions, as well as for the baby, so prenatal, premature birth and things like that. So that's one. If anyone is worried about that or knows, young women who are pregnant, breastfeeding, who are reluctant, it's something really to encourage.
Today is actually National Premature Birthday. It's never knew that existed. Which is we never knew that. So many things, you get to learn.
I wasn't aware of that either.
Exactly. So we kind of touch base on the perinatal care kind of thing. So do you have anything to add to that, or I've got
I think that's pretty well covered.
Okay. So can we go to the cervical screening?
Yes. So yes, there's a lot of other screenings. So the women in India, I can't quite speak for what the recommendations are there, but I will go by what Australia recommends, and might also give a guide.
Just a general guide. So at least it's a guide which they can relate to. So I think probably might also have similar ones, but which I'm not aware of. Any doctor from India watching, perhaps maybe you can, pass on a comment if you have anything specific, so that even we also can become aware of it. It's just for our knowledge as well. Continue, because we are kind of you're an Australian practice GP, so we will stick to the Australian general thoughts.
So I guess that there are quite a few things for screening that is available. So why we recommend screening is because we would ideally like to pick up cancers or medical conditions before symptoms arise. So these tests are simple tools which have had a lot of funding from the government and a lot of research to prove early pickup. So cervical screening, particularly so actually since end of 2017, the screening has changed a little bit. For all those women who haven't had screening since 2017, I'll remind that what the changes are. So now it is every 5 years after the age of 25 years of age, provided you've been sexually active in the past. So the main thing is that it's the same procedure. It's a pap smear. We do that every 5 years if it's normal. Otherwise, what the main change, why before it was every 2 years, right? Now we have had many advancements with the screening methods. So we test for the earliest possible change that predisposes to cervical cancer, and that's the HPV virus, which human papilloma virus. So if this is present, this virus in the test, then we do some, I guess, more regular follow-ups to one, make sure that it has cleared, maybe send you to a gynecologist. Okay.
Yeah.
But
So
otherwise, yeah.
I did say 5 years. Obviously, one wouldn't come to know if there is anything abnormal or some abnormality noticed during that 5-year period. So what happens at that time?
Yep. So 5 years is a long time, exactly. So actually, it's very important that you do watch out for certain symptoms. So let's say you are getting spotting in between your periods, or your post-menopause, you've gone through menopause and you notice bleeding after, you know, menopause. That's abnormal. Yeah. Or the other thing is also what we call post-coital bleeding. So that's bleeding after intercourse. Now, these are abnormal signs, and it could indicate a problem in the cervix. So you should follow up with the GP if any of these things were to happen in that 5-year interval.
Period. Right.
Yeah.
Right.
And then we would need to do a sooner test.
Yes. Right. Right. Okay. So what about the National Screening Register, the Cervical Screening Register? Can you just shed some light on that?
So you should be getting some reminders from this screening program. So it is an opt-out system. So you will automatically, once you get your first pap smear, you will be in this register, and the government sends letters and reminds you. Also, GP clinics should have it on their system to remind you when you're due. It's just a reminder system.
It's such a great way to kind of like, you know, get reminded. But no, just, you know, it just comes so quickly, like, you know.
Yeah, that's right.
Yeah, but it just comes so quickly. You know?
That's right.
Just,
but I do want to raise. Yeah, exactly. It's already been 5 years. Yeah. But exactly. I do want to raise an important point with the cervical screening. Now, a lot of women feel, I've only, you know, been with my husband my whole life, no other partners, you know, how I should be safe from this, you know, any sort of cervical issue. And if they've had a normal one that in the past, a lot of women feel that they don't need to repeat it again as they get older. Now that's a myth. So that's actually incorrect. Now, reason being because there can be a reactivation of this virus, HPV, which can happen years down the track. So sometimes it can just be silent in the system and we don't pick it up till it becomes reactivated. So it's very important you still get screening. It's actually till the age of 74, so which might seem quite long, but that is the recommendation.
Okay. Yeah, and that's also similar to the bowel cancer, isn't it?
That's right, yeah. So the bowel cancer screening is also till 74, and that is also with the bowel cancer screening register. So you should be getting reminders, and the stool. It's called a fecal occult blood test. So that comes with that kit, fun times to collect, but it's a very important tool as well. So that's every 2 years.
But that is only for 50 plus, isn't it?
Yes, so that's from the age of 50. So a lot of things start happening after age of 50. You suddenly get very popular from the Australian government,
especially from the cervical screening team. and the bowel cancer,
Yeah.
you're very
That's
popular.
right. The breast screen and colon cancer screening, all from 50, they'll keep reminding you. um,
That's
so that
interesting.
leads me, I guess,
About
to
colon
the...
cancer. So
Sorry?
you mentioned about colon cancer screening. What is that? I haven't received anything.
So that is the bowel cancer screening. Yeah,
Oh,
that's
it's the same.
the...
Oh, sorry.
Yes, that's the same thing. So that's the same stool test, is the one.
Okay.
Now, some people are at higher risk, and we, sometimes suggest colonoscopies for certain groups of people, rather than just the stool test. But that's something that your doctor can advise if needed.
Okay, perfect. So in that instance, a gastroenterologist or a colonoscopy, depending on like whatever it would be. Is that right?
Yeah, that's right.
Yeah. So since we are touching base on bowel cancer, cervical screening, etc. What about breast cancer screening?
Breast cancer. So that's another very important one. So
in the last few weeks, I did have someone on, her name is Dr. Usha Salakame. She is a cancer research specialist, and she was on the Wholesome Wednesday sharing her research journey and all about, breast cancer and its importance. So you will be, from a doctor perspective, hers was more research based, and yours will be more from a GP side of thing. So it would be great to hear from. And I did have Dr. Rekha Rao in the early Wholesome Wednesday session. She also touched base on breast cancer screening as well. Probably the audience would have forgotten. So perhaps maybe you can repeat.
Yeah, so I'll give a quick reminder. I'm sure they covered things really well.
Yeah.
So the main thing, like I was saying, so after 50, that's when the breast screening starts, with the breast screen New South Wales, or other states have similar programs where you get a mammogram for free every 2 years. And this is a very good screening tool to pick up early breast cancers. But in saying that, so the age 40 to 50, you can actually also start doing requesting the mammograms. So that's
from a GP.
No, actually, you can go through Breast Screen New South Wales if you're between 40 and 50.
Would like to.
Yeah, you can call them to make an appointment, and you can actually get it for free between that age group if you wish. But
so ladies, anyone between the age of 40 to 50, just listen. You can walk into the breast screening unit. Obviously, no, just call them, make an appointment, and you can go. Not necessary that you need to have a GP referral. So, which is another hassle, isn't it? Going to a GP and getting a referral done. But now it's all telehealth.
Yeah, it can be easier now with that. But so that's something you can do if you're in that age group. Now, another thing before, again, 2 years is a long time, isn't it? And actually, we try and encourage women from in their 20s to do self breast checks. Now that's also important for your own screening. So I mean, you might feel, oh look, I don't know what I'm looking for, I'm not medically trained, this that. But why we encourage this is so basically feeling your breast every month ideally can help you to become familiar with what your breasts normally feel like. Yeah, that's all we want you to do. We want you to be familiar with your breasts, and if you have any concern, look, it's a bit more painful, or this feels like maybe a lump that wasn't there before, then you can visit the GP earlier, and we can just examine ourselves and see if we need to investigate sooner or anything. So I've actually picked up cases of breast cancer through this way as well. It's people if you are concerned, we actually take it very seriously, and you know, things can be picked up sooner. So it's very important to do that. And age is actually not something that we can
Is related
you know,
to that
take
one.
for granted. Yeah. So we are seeing breast cancer, unfortunately, in younger women as well. So that's why, you know, from I think, you know, if you have daughters, even encouraging them in their early 20s to start getting into the habit of this.
So early 20s as well.
Yep, that's right. Earlier on, the better. Yeah.
Yeah. So just out of practice, is kind of like, you know, checking the breasts and everything okay during the time of shower? Is that an ideal way to do?
Yeah, that would be a good time. I think that's, you know, a time that you have on your own. So it's actually, you know, that's, you know, choosing maybe a particular time of each month. Sometimes I suggest, okay, if you're having your periods, you know, first few days of your period, or the first day of every month, even, you know, something like that would be
But
good to
is it
remember.
okay during the time of your periods, because breasts
Yeah.
normally kind of, you know, swell and everything? So
Yeah.
is
So
that,
I guess
you know,
the thing is using the same time every month, ideally, because then you have some common I guess your hormones are similar each time, each
similar?
month, that
Okay,
way. Yeah.
that way. Perfect. So ladies, make a note of that. So even early 20s. So please bear in mind and look after that. What else I have to ask about breast cancer? I think I have covered. You have, yes, if you have covered everything, come on, add something more.
I think that should be good.
Good. Okay. Now we will touch base on bone health, osteoporosis.
Yeah, so I'll just briefly mention about that. So osteoporosis screening is a bit of a complicated one. Usually we start at after the age of 70, every
So
2
it is
years.
not before that.
Yeah, so there are exceptions. So it really, it all depends on your risk factors. So,
Right.
for example, if you have a high predisposition from family history, so, you know, your mother may have had osteoporosis at a younger age, or the other things that we look for are certain medical conditions can predispose you to osteoporosis, such as hyperthyroid disease, for example. The other thing is, if you happen to have a fracture, which is, you know, a low trauma fracture, so then we are a bit suspicious and do these tests, the osteoporosis tests, earlier.
Right.
So
What else one feel like, you know, if someone has to go and get like, you know, I don't know what test is done for osteoporosis. Is that the bone density test?
yeah, it's the bone density test, and
Yeah.
and
So can anyone request a GP, or you have to have
no,
this? How would
yeah.
one know that, you know, they are having osteoporosis?
Yeah, so it is a tricky one, and that's why we generally will ask you some questions. I think it's a good idea. That's why family history and going
Yeah.
to the same GP generally, if you follow up with, you know, we become a bit more aware about your general health and your family history. And if we feel you're at a higher risk, we will start screening earlier that way. Yeah.
Right. What else I've got to add about osteoporosis? Oh, you mentioned about hyperthyroidism and celiac. So celiac is like, you know, one of the common ones, isn't it? The celiac disease.
Yeah, so celiac disease is where you totally intolerant to gluten. So why that can have a higher risk is because a lot of nutrients are not absorbed as well in that condition, which can affect bone health. So it's a lot of absorption issues, basically. So that's one of the things. There's certain bowel diseases, again, because of absorption issues, that can affect bone health as well. So that's why certain medical conditions we are needing to screen you a bit before the age of 70, but majority of people, if they don't have high risk factors, it's after that age.
Right. I think we kind of like touched based on that. Moving on to the next one, we'll talk about most general health checks, like, blood pressure, cholesterol, diabetes.
Yes. I know there's a lot, and look, I could be talking for days about all the rest of these, but I will touch on it, and I think it's important, particularly having Indian backgrounds predominantly in this group. There is a higher risk factors for in Indian population for heart disease, hypertension, blood pressure and diabetes. So these are all important things to check out with the doctor. I generally advise, if you don't already, going to your GP every year after the age of 40, or at least every second year. I think annually would be preferable, just so that they can have a check your blood pressure. Look, it might need to be more frequent than a year if it's a bit high, but otherwise also blood tests would be generally about every 1 year, every 2 years if it's very stable. So we can screen these things earlier that way, and also we want to prevent heart disease, right? So all these medical conditions can be optimized, so we can do that. Other than that, I guess it'll also depend on your family history. So if you have a strong family history of heart disease, high blood pressure, diabetes, you definitely need to be more vigilant about getting these things tested.
So the same thing would be applicable for diabetes as well as cholesterol.
That's right. Yeah, because all these things unfortunately can put you at a bit higher risk if you have a family history. A lot of genetic predisposition for these conditions.
Is a diet an important factor here to control the BP, the cholesterol, and your heart condition, or whatever it is? Is diet important?
Lifestyle is the most important thing. So that's when a lot of preventative things can be done. So of course, the diet to reduce fat intake, sugars intake, or certain carbohydrates can all help. Of course, also, the Heart Foundation also recommends at least 30 minutes of moderate exercise a day. All these things can help. There's a certain degree, though, for some people, that genetics, unfortunately, even if they do all the right things with diet, exercise, sometimes we can still see high levels, but it's not wasted. So even if you are finding, I still have a high level, you still will benefit from for heart disease regardless. So
and how often do you have to check your BP?
So it all depends how your control is for the blood pressure. So say, you know, the recommendation is less than 140 on 90 for non-diabetic people, 130 on 80 and less for diabetic people. So if it is, you know, within target, every 6 months, every 12 months, if it's very stable, is okay, but otherwise it may be more frequent.
Right. I think I have covered that. Is a cardiologist intervention required if, like, you know, if you have unstable cholesterol or diabetes or blood pressure, or just a GP kind of like review is sufficient?
So it depends again on if there's a family history of heart disease. I generally would suggest that we see a cardiologist if you have you know, definitely if you have diabetes and heart disease family history. Blood pressure, if it is poorly controlled blood pressure, then yes, it is worthwhile. So it's really something to talk with the doctor about. We generally like to you know, look at each case individually and see your risk factor for heart disease. There's certain tools and calculators that we do to give an individualized kind of risk, and as based on that, we recommend if you need to see a cardiologist or not. Yeah.
Okay. All right. So we have touched base on so many things, and now the very important one, you know, which has taken the world by storm, is our dear friend COVID vaccine. Can you touch base on COVID vaccine? I know there's flu vaccination. I think is flu vaccination now done and dusted? Like nobody takes flu vaccination. Is that correct?
Oh, so the flu vaccine is still there. I think it's taken less. Yeah, so I mean, this past year, I think the flu vaccine was almost a sideline thing, but it is still important. So that's something annually and ideally, you know, in time for winter. COVID vaccine, everyone is all over it. You know,
but what is the percentage rate in New South Wales? So which is really good.
We've got a great rate here.
So they will be introducing the boosters very soon. So
so that's an important thing for everyone to become, you know, a bit vigilant about. So I'm assuming I don't need to convince anyone to take the vaccine, I hope, but you know, it is life-saving. So let's go on to the boosters. So the recommendation is 6 months since your second dose of your vaccine. So you know, that's something important. We want to avoid any sort of third waves, or you know, they're on fourth, and a lot of, so particularly in New South Wales, Victoria, you know, a lot of people may have had to put their interval for the AstraZeneca vaccine at least shorter. So there can be some question about how the longevity of the vaccine, you know, the immunity. So that's why the booster is very important for those people, but everyone, just so that we can optimize that immunity. Yeah.
And what about the other vaccinations, like, you know, for shingles or pneumonia? Is there a vaccination for pneumonia?
Yeah, so after the age of 70, there's a vaccine for shingles and pneumonia as well. So they're kind of one-off vaccines. They have longer term immunity. You don't need to get it every year. The other one as well is the whooping cough and tetanus. So that's something, every 10 years we advise to get that. And particularly if you're going to become a grandparent or close contact family with, you know, babies, the whooping cough one is important to keep up to date.
Right, right.
Yeah, so I think that sums up most of the immunizations actually. So
if I have a baby, what vaccination is important for me?
well, the COVID vaccine would be great, as well as the whooping cough.
That one should take before visiting the baby.
just the whooping cough, if you've had it within 10 years, would be great. That's particularly for close contacts who do advise that. And yeah. So you can visit my baby.
Like, you know, one of my friend's daughters who gave birth to the baby, like, you know, last year, you know, she was all raving about, oh, we all have to get vaccination. What vaccination you're going to get?
Yeah,
so that's the topic.
That's the one.
There you go. There you go. So anything else, Noor, you want to add? We have covered a whole range of topic. I think there was one or two questions. Let me just scroll through to see whether I did see something pop through. Okay. Radhika is asking, why do we get food cravings during pregnancy?
That's,
so
yeah.
What's your way?
So I think the food cravings particularly seem to happen because of the hormone changes. So I think, oh look, there's so many theories. Not too much, to be honest. I was quite simple with that, but probably more sweets than anything. That's been a bit of a thing. But
I just love coffee, and coffee was the one which I used to hate.
Oh,
I hate coffee.
Oh wow! See, that's that was the opposite for me. I could not handle coffee. So some people get what we call food aversions, where actually they can't handle certain foods, but the other extreme is craving. And so
the Indian background, you know, especially like my sister-in-law, she would never kind of like, you know, bear the you know, the smell coming out from dal, like, you know, when they cook the dal, rice, and she couldn't just stand those two, like, you know. We were two opposites. For me, coffee, and for her, everything.
Yeah. That's right. So it could really vary.
Got one more question there. I'll just say hello to all of these whilst I'm doing that. Geeta Nagaraj, thank you for joining in. Thank you, Rupa. Thank you, Ranjita. Thanks, Latta. Thanks, Sasha. Thanks, Pallavi. Thanks, Jabin. Thanks, Shilpa. Thanks, Vasudha. Thanks, Neha. Radhika is saying, I used to crave for guavas. Wow, I love guavas. Do you know, Noor?
Sorry, what was that?
She says she used to crave for guavas.
Oh, okay.
I never heard of guavas, you know, someone craving for guavas. Like, you know, maybe khatta, you know, a tamarind, you know, people love tamarind.
Maybe, that's true.
I put mango, like, you know, the raw mango, the elongated one. Oh.
Yes, I've heard that can be some.
And Sneha saying hi. I think I have covered saying hi to everyone. Thank you so much, ladies, for being patient. Oh, no, I have missed Shruti. Hi, Shruti. I've missed Supreet, Pratima, Archana, Veena. I think I have said hi to everyone now. If I missed any, sorry, ladies. I think I have covered everyone. Great. Thank you, Noor, for joining me.
No problem. It's been a pleasure.
You dare to drape a sari, which is really good, without the help of your mom or mom. So nice.
Thank
And I
you.
look forward to your photos so that I can do a collage and feature tonight on the cover page. And it was such a pleasure to have you on board. And I wish you all the very best and enjoy your motherhood. When are you due?
28th of December.
28th December. There you go. It's not too
6
far off.
weeks
You're
away.
Are you still working?
Yes, I am still working. Yes.
Still working. The sport. Even with me, I was almost full term up until the 9th month I was working. I also used to, in those days I had my Luna, so I used to ride on the Luna as well.
Oh, wow. Good on you.
So, yeah, and I wish you a very happy motherhood, which you will be looking forward to, and I'll definitely come and visit you next year.
Thank you. Sounds good.
Thank you so much for joining me in, and pleasure.
No
it was such a pleasure to have you.
No problem. Glad to be there. Thank you, everyone.
Yeah. Thanks, ladies. Noor and Hema signing off. Watch out for next week's session, which will be another interesting one. Again, touch basing on a little bit of health, and just look forward to having you all next week. But I will announce what it will be on Sunday. Thanks, Noor, once again.
Thank
Bye
you.
for now. Bye,
Bye.
ladies.